Welcome back to our Friday news feed where we're covering the latest headlines that are affecting your health. And joining us now is dentist Dr. Bill Dorfman. He's going to help us answer some questions that we have about some recent news regarding visits to the dental office. Now, admittedly, most people fear going to the dentist just because maybe it hurts a little bit. They realize their teeth haven't been that clean. But having your wisdom teeth removed, it may be a harmless procedure. It's not fun, but a recent story of a young man has us concerned that it may not always be without danger.
The family of the Murrieta man who died after wisdom teeth surgery wants answers.
Mark Lipinski was a popular athletic go-getter, a whiz at high tech who helped develop software to turn flat-screen night and thermal vision pictures into 3D. A huge advance for those in combat. A promising life cut short last month when he died after complications during oral surgery to remove his wisdom teeth. The patient began to wake up and cough during the procedure and was given propofol. Lipinski died 3 days later.
We don't know exactly what happened in this particular case, so we're not going to place judgment, but there was reports of maybe a piece of gauze being in the throat, numerous sedatives in place. So propofol is the same medicine that reportedly caused Michael Jackson's death. When you give someone propofol or any other sedative, anesthetic for that matter, it does one thing. And you're going to look at this animation, which is going to show when you inject these medications into a vein, it's designed to sedate you so you don't have any memory and you don't feel any pain, because that's the whole idea. You don't want to feel your wisdom teeth coming out, but it does another really important thing. It suppresses your rate of breathing. It can slow your heart rate. I call it a cliff. If you give too much and you are not accurately monitoring someone, they can die very quickly. That's why it has to be such a controlled environment. If you're not monitored properly, which is what reportedly happened with Michael Jackson, death can come quickly.
Here's the important point to take away. You don't have to be deeply sedated. You can use a very, very light sedation, which is really safe, you know, Versed with a little cocktail, something like that, where you're not really putting the patient that deep to sleep. But if you really need to knock somebody out, get an anesthesiologist.
Exactly. And Dr. Dorfman, I think the point is not all wisdom teeth are the same, right? Some can be much more complicated, so-called impacted. It depends how many teeth you're trying to do at one setting.
And it's also the patient. I mean, literally, you could probably take out my appendix with me being awake as long as I didn't feel it. I wouldn't care. Where there are other people, you bring a needle to them and they freak out.